Good evening. This is All India Radio. I am Naresh Mago and with me is Manoj Singh Rana with the evening news. The headlines. Centre rules out shortage of COVID-19 vaccine in country, urges states to review availability of vaccine at various cold chains and reappropriates them as per the demand. Government is fast-tracking emergency use approvals for foreign vaccines to expand coverage of vaccination drive in the country. Prime Minister Narendra Modi inaugurates 6th edition of prestigious Raisina Dialogue. Eliminating TB from India to have deeper ramifications for the whole world, says Health Minister Dr. Harshvardhan. Commerce Minister Piyush Goyal inaugurates eSanta app for providing a platform for aqua farmers and buyers. Political campaign heats up for 5th phase of assembly elections in West Bengal. India and France to advance their shared post-COVID agenda through close collaboration. World Health Organization urges countries to suspend sale of live wild mammals in food markets in view of infectious diseases. And in IPL cricket, match underway between Kolkata Knight Riders and Mumbai Indians at Chennai. As the number of COVID cases is on the rise again, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. Now the news in detail. The centre has ruled out any shortage of COVID-19 vaccine in the country, underlining that the problem is not of vaccine availability, but of better planning in the states for vaccination. Briefing the media in New Delhi, Union Health Secretary Rajesh Bhushan urged the states to review the availability of vaccine at various cold chains and reappropriate them as per the demand in different areas. He said it will help in ensuring vaccine at all points and check the wastage. Mr. Bhushan said so far, Centre has provided over 13 crore 10 lakh doses to states and union territories. He said of them, the total consumption, including wastage, was 11.43 crore doses, and currently over 1.67 crore vaccine doses are available with states and union territories.
राज्यों के पास जो उपलब्धता है, unutilized doses available with the states and union territories, उसकी संख्या 1,67,20,000 से अधिक। इस माह में यानी अभी से लेकर अप्रैल माह के अंत तक जो सप्लाई राज्य सरकारों को और संघ शासित क्षेत्रों को प्राप्त होगी वो 2,01,22,960 डोजेस की है। तो इससे ये स्पष्ट होता है कि समस्या बेहतर प्लानिंग की है, समस्या डोजेस के अभाव की नहीं है।
The Health Secretary said on one hand there are states like Kerala where there is zero wastage of vaccine, and on the other hand several other states which are reporting 8 to 9% wastage.
केरल जैसे राज्य हैं जहां शून्य वेस्टेज है, दूसरी तरफ अनेक ऐसे राज्य हैं जहां आज भी 8 या 9% वेस्टेज है। तो अगर वेस्टेज को मिला दें और कंजम्पशन को देखें तो राज्यों ने 11 करोड़ 43 लाख डोजेज का इस्तेमाल किया।
Mr. Bhushan expressed concern over the rising cases, saying the previous highest COVID-19 surge has been crossed and the trend is upward. He said Centre is working with states and union territories to tackle the situation. The Secretary said about 53 central teams camped in districts with high cases of COVID-19, helping states tackle the rise in infection. The central government is fast-tracking the emergency use approvals for foreign vaccines. This will expand the coverage of vaccination drive in the country. The Health and Family Welfare Ministry has announced that it is accelerating the approval process for foreign vaccines that have been granted emergency use authorization by several foreign drug regulators like US Food and Drug Administration, European Medicines Agency, and others. National Expert Group on Vaccine Administration for COVID-19, NEGVAC, has recommended that COVID vaccines which have been developed, manufactured and granted emergency approval for restricted use by several foreign drug regulators and listed in the World Health Organization's emergency use listing may be granted emergency use approval in India. In order to cut short the time lag for approval of potential vaccine candidates, the provision of clinical trials before being recommended by the drug regulator has been relaxed. NEGVAC has, however, mandated post-approval bridging clinical trials in place of conduct of local clinical trial. It has also been said that the first 100 beneficiaries of such foreign vaccines shall be assessed for 7 days for safety outcomes before the vaccine is rolled out for further immunization programs within the country. Our correspondent reports that vaccination is one of the important strategies adopted by the Centre to curb the spread of the COVID pandemic in the country. This decision will facilitate quicker access to such foreign vaccines by India. It will also provide a fillip to vaccine manufacturing capacity and vaccine availability in the country.
The number of total active cases of COVID-19 in the country further swelled today to comprise nearly 9.24% of the total reported cases. The Health Ministry has informed that currently over 12,64,000 people are reported to be suffering from COVID-19 and are either hospitalized or under home isolation. In the last 24 hours, the number of new cases witnessed a marginal decline as the nation registered 1,61,736 fresh COVID cases. The COVID-19 recovery rate in the country today recorded a further downward slip to stand at 89.51%. Since yesterday, over 97,000 people have been discharged from hospitals or reported to have been completely cured. Till now, over 1,22 lakh people have recovered from the infection in the country. 10 states, including Maharashtra, Karnataka, Chhattisgarh, Delhi, Tamil Nadu, Uttar Pradesh, Punjab, Madhya Pradesh, Gujarat and Kerala, continue to be the major hotspots of the pandemic. The Department of Biotechnology has announced that it has approved additional funding for clinical studies of mRNA-based COVID-19 vaccine HGC-019. This funding has been provided under Mission COVID Suraksha. The vaccine is developed by Pune-based biotechnology company Genova Biopharmaceuticals Limited. The company has initiated the process to enroll healthy volunteers for the Phase 1 and 2 clinical trials. Expressing happiness that India's first mRNA-based COVID-19 vaccine is going for the clinical trial, Secretary of Department of Technology Dr. Renu Swarup said, "This is a new technology and has never been used for vaccine manufacturing in India before." She said, believing in the potential of this technology, the department has provided seed funding to Genova to develop this technology. The department informed that HGC-019 has already demonstrated safety, immunogenicity and neutralization antibody activity in the rodent and non-human primate models.
In the wake of a massive spike in COVID cases in Maharashtra, the state government has appealed to the followers of Baba Saheb Dr. Bhimrao Ambedkar to pay their tributes from home to the architect of the Indian Constitution on his 130th birth anniversary tomorrow. More from our Mumbai correspondent.
Amid surge in COVID cases in Maharashtra, the 130th birth anniversary of Dr. Babasaheb Ambedkar is going to be a low-key affair. Chief Minister Uddhav Thackeray, in his appeal to the people, has said that followers of Dr. Ambedkar should pay their respects from their homes and not to converge in large number to celebrate the birth anniversary. At Diksha Bhumi in Nagpur, where Dr. Ambedkar embraced Buddhism, there too the prayers and floral tributes will be offered in the presence of limited people. The state government has been consistently appealing people not to step out of their house in the wake of rapid spread of COVID-19. On the auspicious occasion of Gudi Padwa today, various traditional programs across the state were suspended and the celebration was confined to households. Kunal Shinde, AIR News, Mumbai.
In view of the rapid surge in COVID infections in Rajasthan, Chief Minister Ashok Gehlot reviewed the situation in a high-level meeting this evening. Health Secretary of the state, Siddharth Mahajan, said in the meeting that the positivity rate in the state was 2% in March, which has now increased to about 8%. More from our Jaipur correspondent.
Health Secretary of the state, Siddharth Mahajan, told that 133 people died in the last 12 days due to COVID infection. The COVID test has been increased and about 60,000 samples are being tested daily. Mr. Mahajan told that there is no shortage of remdesivir injection in the state and its availability is continuously being monitored by the government. Principal of Sawai Mansingh Medical College, Dr. Sudhir Bhandari told that the new mutant of COVID-19 is very deadly. He said that now a large number of youth and children are also getting infected. Meanwhile, 5,528 cases of COVID-19 have been reported in the state today. 28 people have also died in the last 24 hours due to infection. Jitendra Dwivedi, AIR News, Jaipur.
In Uttar Pradesh, Chief Minister Yogi Adityanath has isolated himself from some officers of his office who were tested positive for COVID-19. In his tweet message, Yogi Adityanath said that as a precaution, he is isolating himself and has started working virtually. He has also appealed to the people of the state not to pay heed to the rumours. Yogi Adityanath said that central and state governments are working together in the fight against coronavirus. Today, the highest number of COVID cases have been found in the state after the outbreak of coronavirus in the country. More than 18,000 new COVID patients were found in last 24 hours. More than 5,000 new COVID patients have been found in the state capital Lucknow alone, followed by Kanpur and Prayagraj. The state currently has more than 95,000 active patients. The highest number of 85 deaths have been reported due to COVID in a single day in the state. Meanwhile, night curfew has been imposed in few other cities of the state. Restrictions imposed on the number of devotees at Sri Ram Janmabhoomi Parisar in Ayodhya also. Now only 5 devotees can do the darshan at one time. Ban has also been imposed on distribution of prasad. Kerala continues to report high surge in COVID cases as it confirms 7,515 new COVID cases today. The state will enforce more stringent COVID restrictions. There are presently 52,132 active COVID cases in Kerala. 2,959 recoveries were also reported today. The test positivity rate rose and is above 10%. 20 more deaths were confirmed due to COVID today, taking the death toll to 4,814. Meanwhile, as the COVID situation worsens in the state, new COVID restrictions come into force that limit the telemedicine facility, e-Sanjeevani facility, further strengthened to avoid hospital visit as far as possible. Public functions to a maximum of 200 people limited and to a 2-hour duration. If the functions are held in closed area, only 100 people are allowed. All the shops and restaurants in the state must close at 9 p.m. Mega shopping festivals are banned across the state. Only 50% of occupancy is allowed in hotels and parcel services need to be encouraged. Meanwhile, COVID-negative certificate is made compulsory for those participating in Thrissur Puram.
Talking to All India Radio, Dr. Sanjay Pandey, Professor of Neurology, GB Pant Hospital, Delhi, said the COVID-19 vaccination coverage will be increased very soon. Dr. Pandey said if anyone feels sick with throat infection and cough, it is better to get an RT-PCR test done at the earliest.
कोविड के सिम्टम सर्दी जुकाम से मिलते हुए होते हैं, जैसे गला में खराश, बुखार, इस तरह के सिम्टम अगर इस समय आते हैं तो कोविड की जांच करानी चाहिए। कोविड की जांच आप किसी भी सरकारी अस्पताल में करा सकते हैं या किसी प्राइवेट लैब में करा सकते हैं। कोविड की जांच रिपोर्ट 4 घंटे तक भी मिल सकती है, लेकिन चूंकि अभी कोविड के केसेस ज्यादा हो रहे हैं तो 24 घंटे के अंदर जांच की रिपोर्ट यूजुअली मिल जाती है, लेकिन कई बार थोड़ा सा वक्त ज्यादा भी लग सकता है। कोविड की जांच आप किसी भी सरकारी अस्पताल या किसी भी प्राइवेट अस्पताल या प्राइवेट डायग्नोस्टिक सेंटर से करा सकते हैं। 2 तरह के टेस्ट है। पहला टेस्ट है रैट, जिसको रैपिड एंटीजन टेस्ट कहते हैं, लेकिन ज्यादा रिलायबल टेस्ट RT-PCR है। RT-PCR करने के भी कई तरीके होते हैं, तो अगर पेशेंट सिम्टोमेटिक है तो बेहतर है कि हम पहले RT-PCR कर लें।
Prime Minister Narendra Modi inaugurated the 6th edition of the Raisina Dialogue, India's flagship global conference on geopolitics, through a video message this evening. The 4-day dialogue is being held virtually. In his speech, Mr. Modi said, this edition of Raisina Dialogue takes a place at a watershed moment in human history. He said a global pandemic has been ravaging the world for over a year.
This edition of Raisina Dialogue takes a place at a watershed moment in human history. A global pandemic has been ravaging the world for over a year. The last such global pandemic was a century ago. Although humanity has faced many infectious diseases. Since then, the world today is underprepared to handle the COVID-19 pandemic. Our scientists, researchers, and industry have answered some questions. What is the virus? How does it spread? How can we slow it down? How do we make a vaccine? How do we administer vaccine at scale and with speed? To these and many other such questions, many solutions have emerged. And no doubt, many more are yet to come.
The Prime Minister said for over a year now, the best minds of our societies have been engaged in battling this pandemic. All governments at all levels are trying to contain and control this pandemic. Mr. Modi said India has supplied vaccines to over 80 countries. President of Rwanda, Paul Kagame, and Prime Minister of Denmark, Mette Frederiksen, also addressed the inaugural session as chief guests. The event is jointly organized by the Ministry of External Affairs and the Observer Research Foundation. The theme for the 2021 edition is Virtual World, Outbreaks, Outliers, and Out of Control.
You're listening to the evening news on All India Radio. A reminder of the headlines before we move on. Centre rules out shortage of COVID-19 vaccine in country, urges states to review availability of vaccine at various cold chains and reappropriate them as per the demand. Government is fast-tracking emergency use approvals for foreign vaccines to expand coverage of vaccination drive in the country. Prime Minister Narendra Modi inaugurates 6th edition of prestigious Raisina Dialogue. Eliminating TB from India to have deeper ramifications for the whole world, says Health Minister Dr. Harshvardhan. Commerce Minister Piyush Goyal inaugurates eSanta app for providing a platform for aqua farmers and buyers. Political campaign heats up for 5th phase of assembly elections in West Bengal. India and France to advance their shared post-COVID agenda through close collaboration. World Health Organization urges countries to suspend sale of live wild animals in food markets in view of infectious diseases. And in IPL cricket, match underway between Kolkata Knight Riders and Mumbai Indians at Chennai. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the evening news. Prime Minister Narendra Modi has extended his best wishes for the holy month of Ramazan. In a tweet, Mr. Modi said Ramazan gives an important message of serving the needy and underprivileged. He said it also reaffirms the importance of equality, brotherhood and compassion.
In West Bengal, 45 constituencies across 6 districts will go to polls in the 5th phase of elections on 17th April. Maximum of 16 seats are in the districts of North 24 Parganas. A report from our Kolkata correspondent.
Notable theatre personality turned state cabinet minister Bratya Basu, film star turned MLA Chiranjit and former minister Madan Mitra are among the high-profile candidates of North 24 Parganas. In Damdam, Trinamool Congress has fielded two-term MLA Bratya Basu, who had won the seat in 2016 by over 9,000 votes. Once considered as the Red Fortress, as the seat was dominated by the CPIM, Palash Das of the party, runner-up in the last election, is again contesting as the Sangyukta Morcha candidate. BJP has fielded Bimal Shankar Nanda for the seat. In Barasat, actor Deepak Chakraborty, popularly known as Chiranjit, is contesting as the TMC candidate. He is challenged by Sanjit Chatterjee of the Forward Bloc and Shankar Chatterjee of the BJP. Former Transport Minister of the state Madan Mitra, who had hit the headlines after getting arrested in multi-crore Sharada scam, has been made candidate by the Trinamool Congress for the Kamarhati seat. Youth leader of the CPIM, Shayandip Mitra, and BJP's Anindo Banerjee, known as Raju, are his main rivals. Issues such as price rise, unemployment, and closed factories are dominating the campaigns, while opposition parties are targeting the ruling party for running syndicates and being involved in scams. Madhuparna Chaudhary for AIR News, North 24 Parganas.
The Union Health Minister Dr. Harshvardhan today said that eliminating tuberculosis TB from India is not only important for the country but has also much deeper ramifications for the whole world. Dr. Harshvardhan said this while addressing the Tuberculosis Technical Consultants Network teams in New Delhi today through video conference. The Tuberculosis Technical Consultants Network teams comprised of WHO National Professional Officers for TB and consultants from across the country. He said as proper diagnosis and prompt treatment are key to TB elimination, the consultant network must now focus on both detecting cases early and preventing the emergence of new cases. The Health Minister also stressed on the need to create a scalable and replicable model at the earliest at the grassroots.
Tuberculosis cannot be eliminated without the active participation from each one of you. On the World TB Day recently, I had officially called out for a TB Mukt Bharat. To fulfill our dream of a TB Mukt Bharat, we need to make this into a genuine people's movement. We will have to do more over and above what we are currently doing.
He said the success of the TB Jan Andolan solely depends on activities reaching the grassroots population, and action has to pivot around states and most importantly in hard-to-reach areas. Dr. Harshvardhan also congratulated World Health Organization WHO for their continued support to India in its journey to eliminate TB by 2025. He said one union territory, Lakshadweep, and one district, Budgam, in Jammu and Kashmir have been declared as TB-free.
Minister for Commerce and Industry Piyush Goyal inaugurated eSanta today. eSanta is an electronic marketplace providing a platform to connect aqua farmers and buyers. Speaking on the occasion, Mr. Goyal said that eSanta will raise income, lifestyle, self-reliance, quality levels, traceability and provide new options for aqua farmers. He said that the platform will change the traditional way of carrying out business from a word-of-mouth basis to become more formalized and legally binding. The minister said that eSanta will act as an alternative marketing tool between farmers and buyers by eliminating middlemen. The platform is available in many languages which will help the local population. The term eSanta stands for Electronic Solution for Augmenting NECSA Farmers' Trade in Aquaculture. The National Centre for Sustainable Aquaculture, or NECSA, is an extension arm of Marine Products Export Development Authority. The Niti Aayog today launched Poshan Gyan, a national digital repository on health and nutrition. The launch event was addressed by Niti Aayog Vice Chairman Dr. Rajiv Kumar, CEO Amitabh Kant, Women and Child Development Secretary Ram Mohan Mishra, and Additional Secretary Dr. Rakesh Sarwal. While launching the website, Dr. Rajiv Kumar said the creation of Poshan Gyan was a landmark moment. He said the real change can be brought about only through changing behaviors on the ground. The Niti Aayog Vice Chairman said high malnutrition persists despite India being a food surplus nation, which points towards a clear need for behavioral change. The Poshan Gyan is launched in partnership with Bill and Melinda Gates Foundation and Centre for Social and Behavior Change, Ashoka University.
Edsel India Limited, a mini Ratna Category 1 central public sector enterprises under Ministry of Education, paid the highest ever dividend of 12.5 crore rupees for the year 2019-20. Minister for Education Ramesh Pokhriyal Nishank received the dividend check from CMD of Edsel Manoj Kumar. The company registered a turnover of 326 crore rupees and a profit before tax of 56 crore rupees during the year 2019-20. India and France have recognized the immense opportunities for great collaboration in diverse sectors, including trade and investments, defense, health, education, energy and climate change, amid changes in a COVID-impacted world. External Affairs Minister Dr. S. Jaishankar and visiting Foreign Minister of France Jean-Yves Le Drian today held bilateral talks in New Delhi. The two leaders held discussions on a number of regional and global issues of mutual interest, reiterating their shared commitment to a multipolar world and faith in multilateralism.
International agencies, including the World Health Organization, have urged countries to suspend the sale of live wild mammals in food markets. They have warned that wild mammals may be the source of more than 70% of emerging infectious diseases in humans. The guidance aimed at ensuring the global food system is safe and sustainable follows a WHO-led mission to Wuhan, China, to investigate the origin of the SARS-CoV-2 virus. Peter Benembarek, the WHO official who led the mission, said this in a tweet. The WHO-led team, which visited the human market in Wuhan, where the first human infections of COVID-19 were detected, said the new virus had probably been transmitted from bats to humans through another animal. Japan will release more than 1 million tons of contaminated water from the destroyed Fukushima nuclear plant into the sea, the government said on Tuesday. The first release of water will take place in about 2 years, giving plant operator Tokyo Electric Power time to begin filtering the water to remove harmful isotopes, build infrastructure and acquire regulatory approval. Japan has argued that the water release is necessary to press ahead with the complex decommissioning of the plant after it was crippled by a 2011 earthquake and tsunami. It says similarly, the filtered water is routinely released from nuclear plants around the world. The decision comes about 3 months ahead of the postponed Tokyo Olympic Games, with some events to be held as close to 60 kilometers from the wrecked plant. Former Japanese Minister Shinzo Abe in 2013 assured the International Olympics Committee in pitching for the Games that Fukushima will never do any damage to Tokyo.
All India Radio Delhi will broadcast a live commentary of the Shahi Snan of Kumbh Mela 2021 on the day of Baisakhi tomorrow. The commentary will be available from 6:10 a.m. to 6:55 a.m. on its Indraprasth and AIR Live News 24/7 channels. The broadcast will also be live streamed on Akashvani AIR YouTube channels. In IPL cricket, Mumbai Indians were 124 for 5 in 17 overs against Kolkata Knight Riders at M.A. Chidambaram Stadium in Chennai when reports last came in. KKR skipper Ewan Morgan won the toss and invited 5-time champions Mumbai Indians to bat first. KKR has gone with the same team which defeated Sunrisers Hyderabad by 10 runs on Sunday. Mumbai Indians, led by Rohit Sharma, on the other hand, replaced Chris Lynn with South African star Quinton de Kock. Mumbai lost their inaugural match against Royal Challengers Bangalore in the last ball thriller.
Now let us take a look at the weather forecast for tomorrow. Srinagar will have a generally cloudy sky with light rain. Temperature will hover between 9 and 20 degrees Celsius. Jammu will have a partly cloudy sky. The minimum temperature will be 20 degrees Celsius, while the maximum will be around 34. Leh is expected to have light snow. The minimum and maximum temperature will hover around -3 and 10 degrees Celsius. Gilgit will have a generally cloudy sky with 1 or 2 spells of rain or thunder showers. The temperature will hover between 9 and 22 degrees Celsius. Muzaffarabad will have a mainly clear sky, becoming partly cloudy towards afternoon or evening. The minimum temperature will be 11 degrees Celsius and the maximum 29. The national capital Delhi is likely to have a partly cloudy sky. The temperature will hover between 20 and 40 degrees Celsius. Mumbai will have a partly cloudy sky. The minimum temperature will be 25, while the maximum is expected to be around 33. Chennai is expected to have partly cloudy sky. The temperature will vary between 27 and 35 degrees Celsius. Kolkata will have a partly cloudy sky. The city will observe minimum temperature of 27 degrees Celsius and a maximum of around 35.
And now, before we end the bulletin, the headlines once again. Centre rules out shortage of COVID-19 vaccine in the country, urges states to review availability of vaccine at various cold chains and reappropriate them as per the demand. Government is fast-tracking emergency use approvals for foreign vaccines to expand coverage of vaccination drive in the country. Prime Minister Narendra Modi inaugurates 6th edition of prestigious Raisina Dialogue. Eliminating TB from India to have deeper ramifications for the whole world, says Health Minister Dr. Harshvardhan. Commerce Minister Piyush Goyal inaugurates eSanta app for providing a platform for aqua farmers and buyers. Political campaign heats up for 5th phase of assembly elections in West Bengal. India and France to advance their shared post-COVID agenda through close collaboration. World Health Organization urges countries to suspend sale of live wild mammals in food markets in view of infectious diseases. And in IPL cricket, match underway between Kolkata Knight Riders and Mumbai Indians at Chennai. For details of these stories and more, log on to our website newsonair.com and News on AIR app. And with that, we end the evening news. Good night.